Good evening, everybody. Thank you for joining us today for AdMeTech Prostate Cancer Awareness in the Times of COVID-19 Pandemic. My name is Kathy Reddick. I am the president of Live Third Foundation, which is a breast cancer support group. And I have worked with Dr. Stern and her team at AdMeTech regarding prostate cancer awareness. My own personal story is that my dad is a prostate cancer survivor. I am a breast cancer survivor and was tested for the BRCA1 and 2 genes. I'm negative. However, I have found out that there is a genetic tie in some families to prostate cancer for patients who have had breast cancer. So I was very interested in participating and getting the awareness out to families, most importantly, as I am a wife and a grandmother and a mother, to the men in my life. I am happy to have joined us tonight on Facebook Live. We have on the Zoom channel, Reverend Brenda Brown from Mass Avenue Baptist Church, the pastor of Mass Avenue Baptist Church. We have Reverend Veronica Truell from Norwood First Baptist Church, as well as Danny Steele, who heads up the men's ministry. And we have Pastor Laura Rise from the United Baptist Church of Jamaica Plain, who will be joining us on the Facebook Live. I want to go ahead and get started with the program and start introducing our speakers tonight. And first off will be Senator Rush, who's going to address legislative perspective on creating and building a model of leadership in prostate cancer and public awareness. Reverend Senator Rush, sorry. You're on mute.
Okay, all right. You think we would all know this by now, right?
I'm telling you, something happens when we hit Zoom, right?
So I apologize, but thank you so much. And again, thank you for having me this evening. Really honored to be with you. And again, through these difficult times, we continue to do things differently, but nonetheless focus on the important issues that are so important to us in our communities and people that we interact with on a regular basis, and just really so important. I just have a few remarks I'd like to talk about, and certainly again happy to be here. But the impact of COVID-19 pandemic and prostate cancer on our communities and our healthcare is just unacceptable. Both COVID-19 and prostate cancer are leading health disparities. In my remarks, I will focus just briefly on prostate cancer and some of the issues going on. As we know, Black men are more than twice as likely to die of this disease compared to white men in a general population. I'd like to highlight the critical importance of addressing prostate cancer care in veterans. As many of you know, I'm an Iraq War veteran, and I receive my health care through the Veterans Administration Hospital here in Boston. And prostate cancer is the most common diagnosed among veterans, representing one of the most significant healthcare burdens in the VA systems, with over 200,000 survivors. Out of approximately 40,000 new cases of cancer among veterans each year, prostate cancer is newly diagnosed in 12,000 veterans, representing as large a fraction of roughly almost 30% of all new cases in veterans. The disease is considered service-related due to soldiers' exposure to herbicides, including Agent Orange. Consequently, veterans are considered high-risk individuals for getting and dying of prostate cancer. Many of our Iraq and Afghanistan veterans stationed overseas have been registering themselves in what's called a burn barrel registry through the VA because of toxic inhalants that were inhaled during their deployment. So that's a focus and a passion of mine as a veteran, chairing the Veterans Affairs Committee in the Senate for 8 years. The reality is there is hope and excitement over the last 5 and 6 years, thanks to so many of you and your advocacy and what you do day in and day out. Research consistently showed that in Equal Access Veterans Health Administration, the disparities in prostate cancer mortality between Black and white men have been eliminated. For example, a recent study showed a racial parity in tumor burden, treatment choice, and survival outcomes in men and prostate cancer in the VA healthcare system. The VA system is directly relevant to Massachusetts with its universal access to care. And as most of you know, Massachusetts is home to just shy of 400,000 veterans living here in the Commonwealth. That's why I, as many of you know, strongly support a statewide program in prostate cancer research, education, and awareness. If the VA could reduce prostate cancer mortality in Black veterans and related disparities with white veterans, Massachusetts programs will lead elimination of prostate cancer disparities for everybody. So again, I want to thank each and every one of you because you folks force others to acknowledge, to be educated, and to act. And I see that Representative Livingstone is on the call as well. And I know that he and I can tell you that it's this type of advocacy that drives the public policy debate on Beacon Hill and ultimately makes real change. This is how it happens. It is individuals who have expertise, such as yourselves, have personal stories, and they take them to the State House and demand action. That's the process. It works. We're committed. And I thank you for including me this evening. Thank you.
Thank you so much, Senator Rush, for your comments. We appreciate it and appreciate the work that you're doing. We are now going to hear from State Rep Jay Livingstone. And you are muted, so you can unmute. There you go. Thank you.
Yeah, thank you. And thanks again. I just want to echo what Senator Rush said. It's so important to have these type of discussions, not only to provide information to the public about what may be happening, but also to get input. And individual stories definitely are what resonate the most in the State House, or just showing firsthand impact. So thank you for hosting this. And the Senator had a lot of statistics. It's not surprising that COVID has disproportionately impacted communities of color in Massachusetts. There is, across the entire health spectrum, whenever you look at almost anything, there's a disproportionate impact on communities of color. In part, it's because communities of color are much more commonly facing affordable housing issues, healthcare access issues, fresh food access issues, and those things are going to play into health. And earlier this year, it was a unanimous vote in the House and the Senate with respect to maternal health to create a specific study to look at that, because again, African American women who are pregnant have a disproportionate impact, have an unsuccessful wanted pregnancy. Or nationally in the United States for COVID, African Americans are 2.6% more likely to be infected by COVID and 2.1% more likely to die by COVID as opposed to a white person. That ties into a lot of the other impacts. And one of the things I think that the state has done better, first of all, it was advocacy like this to push for figuring out if this existed, because the early COVID testing numbers didn't have a racial breakdown. And one of the things that I know Senator Rush and I advocated for the governor to do was to start disclosing that, and that meant recording it when there was an infection, when there was a death. And that as soon as that information was revealed, it showed what many people assumed, which was this disproportionate impact, particularly for African Americans and Hispanics. Some of the things that I think have been favorably done was really focus on focus more testing in response to that. But I think more things need to be done. One of the things that's pending in the State House right now, which you wouldn't think is so related to COVID, but I think of it as is an environmental justice bill to look at, to not put environmentally polluting industries just in the poorest communities in the state. And the air quality in some communities of color is lower
Yeah.
in other parts of the state, and that's having an impact specifically with respect to COVID, but also other health impacts. And for prostate cancer, as Senator Rush said, it's African American men are twice as likely to suffer from prostate cancer, even though it's a risk for men of every single race and ethnicity. And so it's the more we look at, I think that this type of discussion and some of the discussions we've had, in a variety of contexts of looking more specifically at why outcomes are so different based on race, getting at it's not just fixing our healthcare system, it's not just fixing the way police operate, it's not just fixing these specific things, but it's a whole range to really have a fair society, so we don't see these wide disparities. They shouldn't exist, but for the circumstances people live in. And so it's great to have people like Senator Rush to work with on these issues, and we have a long way to go to have the society I think people expect us to have, but I'm committed to continuing to work for that. I really appreciate discussions like this to see other people that are as committed. Thank you.
This is Faye Stern, and if I may, Kathy, for a second,
Yes, please.
I take a minute to express my profound gratitude to Senator Rush and Representative Livingston for championing our programs in prostate cancer, now COVID, and related disparities for years at the State House. Thank you for making it possible for us to have the kind of event we are having tonight.
Yes, I'd like to add my thanks as well. I think we're in good hands in Massachusetts. While there is work still to be done, I am very happy to hear your comments, Representative Livingston, especially coming from Cambridge, and also Senator Rush. So thank you. And yes, please, we need to stay connected. So next I'm going to introduce, actually he's a friend of mine. Can I say you're a friend of mine? He's a friend of mine, a good friend of mine, known for quite a while. Harold Cox is the Associate Dean of Public Health Practice at BU, Boston University School of Public Health. And he is also a prostate cancer survivor that has agreed to come on and talk with us tonight about his experiences and, how things are going now in this time of COVID.
Good evening. And yes, Kathy, I can definitely call you my friend. That's a good thing. I'm going to call all of you my friend, and I especially want to say thank you to the state representative and to the senator for being here. It's so important to be able to hear what you have to say, but appreciate the kind of advocacy that you're doing on all of our behalves in the State House. So I've been asked to talk about two things. The first I've been asked to talk about is COVID. And I think the only thing that's important for me to say as a public health person is that it's important for us to follow the guidelines that have been offered to us of wearing masks, of practicing social distancing, and of taking care of doing good hand hygiene. I can talk a lot about the epidemiology, but that's not important this evening. What's important to say is that I have known people who have had COVID, and I've known people who have died of COVID. It's real. And it is clearly something that all of us need to be mindful of as we take care of ourselves and take care of our friends, relatives, and others around us. The second thing I've been asked to talk about is my experience with prostate cancer. So about 12 years ago, I went to see my doc, and he said, your PSA, or the blood test that is given the prostate-specific antigen to test for prostate cancer, he said, it's not in normal ranges, and I want you to go see a urologist. So, okay, I did. The urologist said, you don't have good numbers, and I think what we want to do is do a biopsy. I want to be honest with you, the biopsy is not a lot of fun. He said, after doing the biopsy, nothing needs to be done right now. So I repeated this 2 more times which meant that I went back to the urologist 2 more times and had 2 more biopsies. They are not fun. However, the important thing is I did them because the doctor said this is what I needed to do in order to understand about my care. After the third time that I had the biopsy, the doc said, "It looks like you have prostate cancer and we need to take some action." Now, I am very used to going to doctors and having doctors say, "You have something and this is what you need to do." In this instance, and what happens in prostate cancer, the doctor says, "What do you want to do?" That's a very scary thing, mostly because I didn't understand all of the options, and I'm a professional person who understands a lot of the literature, but when it came to understanding this, I did not understand. So what was needed is I needed to go now to a number of specialists to hear what they do and hear whether that's the right thing for me to do. I went to the specialist and I heard from each of them about what they do and whether or not that was the right thing for me to consider. On one of those times that I went to the specialist, I went in and the doctor had several other people who were in the room with him. There was probably a medical student, there might have been a medical resident, and there may have been a medical fellow who was there with them. They all interviewed me. The doc said, "Okay, now it's time for an exam." And they all started putting on gloves. And I thought, no, I don't think so. I don't think this is the way this really works. And I had to say to them, there's room for one, but not everybody can go in. Now, the important thing around telling you this is it's important for us to understand that this is my body, and I get a chance to actually say what's the right thing to be done here. So I was able to say to the doc and to the other medical people who were in the room, I'm glad you're all here. Only one person can do the exam. Again, I say this because it's important to understand that each one of us has to take care of our bodies. We decided, my doctor and I, that the course of action that I should take was surgery. So I was very fortunate to have a wonderful surgeon who spent a lot of time with me, Dr. Andrew Wagner, who spent a lot of time helping me to understand what this thing was. So for instance, I didn't exactly know what a prostate was. We all talk about prostate cancer, but the truth is, I think most of us don't have the slightest idea what is the prostate. So here's the lesson on prostate cancer. In our bodies, we make semen, and semen is made up of sperm and of liquid. The prostate produces the liquid. That's the role of the prostate. And there's lots of fancy things that I could say about it, but that is the thing, and it's important to have. So when the doc said you're going to remove it, it was going to obviously impact my body in particular kinds of ways. As the doctor prepared me for the surgery that I was going in for, he said, "Look, after the surgery, you are going to be incontinent." I wasn't certain I liked that, but he said, "That's the deal here. You are going to have difficulty urinating, and you're going to have no control over this. And what you need to do is, in preparation for the surgery, you need to go and get adult diapers." I wasn't quite certain I knew exactly what I needed to do here. And what's more is I didn't want anybody to know that I was going to be incontinent. And I certainly didn't want anybody to know that I was going to be wearing adult diapers. I didn't want to go to the store and run into one of my friends. So what I did is I drove to Springfield. Now, Springfield is 90 miles away. I was pretty certain that I didn't know anybody in Springfield and that it would be okay for me to go to Springfield to buy these adult diapers. I went in the store and I went to the baby product aisle. Wrong place. They don't exist there. I started walking around the store and I didn't know exactly where these things were, but I knew I didn't know anybody in the store. So I knew it'd be all right for me to ask somebody in the store. And I went up to a clerk and I said in my lowest voice, "Ma'am, where are the male adult diapers?" She stared for a while, and in her loudest voice, she said, Martha, as she was calling to her friend, where are the adult male diapers? I wanted to fall through the floor. I just thought this is the absolute end of the world, but the good thing is I don't know anybody at this store, so it's kind of all right. And what happened is nothing. Nothing happened. Nobody came. Nobody was shocked at the fact that I had to have these diapers. It was completely all right. And I recognized at that moment that even though there were some very difficult things that were happening to me at that moment, that I was going to be all right. That it was going to be okay for me to have to take care of myself in the way that I needed to because of this incontinence and because of wearing the adult male diapers. I had the surgery. And true to form, as the doctor told me, I experienced incontinence and I also experienced erectile dysfunction. The doc told me this was going to happen. I have, over the many years of dealing with this, learned to deal with the incontinence and deal with the erectile dysfunction. The important thing to say this evening is that prostate cancer is something that happens. There are consequences that happen, but I would prefer to deal with those consequences than the one of dealing with death. So it's important for me and for you and for anybody else who's dealing with this to take care of the things that you need to take care of and caring for your body. And so I think that there are a few things that I've learned from this experience. I've learned first that it's important to ask questions. I didn't know what the prostate was. I needed to understand what it was. I needed to understand what's this surgical procedure, what's it going to do to me, what are the outcomes, what do I need to do? I needed to also understand that my doctor and I are part of a team. The doc has information, but it's my body. And so the doc and I and the others need to work collaboratively together in order to address the issue that I'm experiencing. It's important to remember that it is my body. The reason that I told the story about all the docs pulling on their gloves is, well, that was just too many people that were just going to try to do a digital rectal exam. They were not going to do that. This was my body. I am in control of what is happening here. I think it's important also for us to talk to somebody, talk to your wife, talk to your partner, talk to whoever it is that's important to you. Find some friends and share this with them. Men actually don't talk about their bodies. Women have this on us. They are much more likely to talk about what goes wrong with them or what goes right with them. Men are much more likely to decide, I'm not going to talk about this. People don't want to talk about erectile dysfunction. People don't want to talk about the digital rectal exam, don't want to talk about incontinence. But it's incredibly important that we do this in order to take care of ourselves. And perhaps the thing that's most important is to find the humor. I promise you, there is a lot of funny stuff that happens. Yes, it's serious and it's things that you need to take care of, but there's a lot of funny stuff that happens. For instance, after my surgery, before my surgery, my urine flow was very, very slow. But after my surgery, my urine flow was incredibly fast. It was kind of like an 18-year-old boy. I could pee. And the doctor said, look, you're going to crack the porcelain. Now, I'm certain that the doctor has said that to every male patient that he has had. But to me, it was the funniest thing that I'd actually ever heard. So find the humor. You'll be okay.
Harold, thank you so much. Thank you. I appreciate it. And it's funny. We'll talk about breast cancer at another time, but you're absolutely right. Find the humor because we can get through this. And I'm so thankful that you are well. And thank you again for joining us. I appreciate it. Appreciate your comments. I'm now going to introduce the president of AdMeTech, Dr. Faina Stern, who is phenomenal and fabulous. I met her last year and talking to her about my breast cancer and then my dad's prostate cancer. She was the first person, even though I had the BRCA1 and 2 gene testing, I had never heard that there was a familial tie between these two cancers. So you opened up my eyes, and I talk about it all the time. I talk about men in my family getting the BRCA1 and 2 test, gene testing when their PSAs are at such a level that they're being watched. So Faye, I thank you, and it's now your turn to talk.
Thank you so much for the opportunity to be here. It is an honor for me to be here with all the distinguished speakers. And it is an honor for me and Thomas Satam, who is managing our community outreach program, to have an opportunity to bring the best knowledge we have to empower people to be their own advocates and to empower people with knowledge. Since in the past we had problems with internet in the middle of presentations, we actually prepared a video that will address some fundamental issues in COVID-19 as well as prostate cancer. Thomas and Maria Nina, if you can please start the video.
Thank you for the opportunity to participate in this event. My name is Dr. Faina Stern, and I'm a president and founder of nonprofit AdMeTech Foundation. My goal today is to talk about COVID-19 pandemic and prostate cancer, two leading disparities. I will talk about emerging advances in prevention, diagnosis, and treatment of COVID-19, and I will address why prostate cancer cannot wait in the time of this pandemic. The main challenge of this pandemic is asymptomatic infections. It can be anyone, including us. What can we do today to protect ourselves, our families, our communities? It's important to remember 5 steps. Social distancing, avoiding large gatherings. Masks, face coverings. As somebody pointed out, your mask protects me. My mask protects you. Protection of our hands through hygiene or gloves in public places. Protection of our eyes. Choosing outdoor instead of indoor activities. If we follow these simple 5 steps, we can reduce viral spread drastically. The best data indicate that universal masks alone can save over 122,000 American lives and prevent countless infections by early January next year. If you're at higher risk of severe disease, talk to your doctor and learn about resources available in your community. High-risk individuals include senior citizens, young children aged 12 months and younger, patients with underlying health conditions, socioeconomically disadvantaged communities, African American, Hispanic, indigenous individuals, recent immigrants, struggling with low income, poverty, homelessness, holding high-risk essential jobs, living in multi-generational housing, also pregnant women. If you have flu-like symptoms, if you're exposed to someone who is sick with COVID-19, assume you may have this disease. Isolate yourself to protect people around you. Call your doctor. Utilize state resources. If you have difficulties breathing or chest pain, call emergency services. COVID-19 diagnostics are critical for early detection, controlling pandemic, and safe return to work and schools. Current challenge is to get rapid testing results for prompt diagnosis, treatment, contact tracing, and isolation. There are 2 types of testing widely available today: for live virus active infection and for its antibodies immune protection. Discuss with your doctor what testing is right for you. COVID-19 treatment is likely to succeed in near term. Multiple organizations are working on treatment strategies and their evaluation. Early detection is critical when mild to moderate symptoms reflect initial viral infection and initial inflammation, for example, in the lungs. At this early stage, Several treatment strategies have been shown to stop virus replication, improve patient symptoms, and expedite recovery, including antiviral drugs, virus-neutralizing potent antibodies, combination treatment, integrating antiviral and anti-inflammatory agent interferon. Extensive conclusive global trials are currently in progress. About 15 to 20% of patients progress to severe life-threatening disease. On June 16, Oxford University announced the first life-saving drug, anti-inflammatory steroid dexamethasone, which is widely available, inexpensive, and can be readily implemented globally. On August 12th, Mayo Clinic lab trial indicated that convalescent plasma obtained from COVID survivors and containing high level of antibodies can reduce risk of death by 35% vis-a-vis low level of plasma antibodies. On April 29, NIH reported that antiviral drug remdesivir expedited recovery in these patients by about 31%. Global clinical trials currently combine antiviral and potent anti-inflammatory agents to maximize patient benefit, and results are expected soon. The most important goal in ending this pandemic is to have publicly available vaccines. The key challenge is our uncertainties if immune protection against the virus is strong enough or if it can last. And yet, growing national and international data show protective immunity for many people after infection, creating hope for effective vaccines. The global goal is to vaccinate billions of people, which will require multiple public and private partnerships. WHO, with multiple partners, established a COVAX facility for equitable vaccine distribution. As of July 15, it was announced that 165 countries with over 60% world population participated in this effort. The goal of US government is to vaccinate 300 million Americans by early to mid next year. To achieve this goal, they support multiple organizations in order to conduct definitive clinical trials and ensure that vaccines are safe and effective, to ensure large-scale production and distribution to the public, and to develop strategies and priority for vaccine administration. Dr. Jerome Adams, US Surgeon General, testified to United States Senate on September 9. I want the American people to hear me say this. There will be no shortcuts. This vaccine will be safe and effective, or it won't get moved along. And when a vaccine is approved by FDA, I and my family will be in line to get it. While we are dealing with COVID-19 pandemic, prostate cancer cannot wait. Unfortunately, men stopped going to clinical facilities out of fear to contract the virus. And yet delays in care can result in reduced quality of life and even loss of life. It is important to highlight that clinical facilities created a safe environment, including telehealth for virtual visits, for ongoing in-person care, for medical procedures, including biopsy and treatment. Delays in prostate cancer care are particularly unacceptable for Black men, who are 2.5 times more likely to die compared to everyone else. And yet prostate cancer is curable when detected early. With early detection, every man survives in 5 years. With late diagnosis, when metastatic spread is present, only 28% of men are alive in the same period of time. The best tool we have today for early detection is blood test PSA, which saves lives. PSA testing, like any other test, is imperfect. In about less than 10% of all men undergoing screening, we see biopsy performed. It is invasive procedure causing pain and infection in some patients. It may be unnecessary. Up to 75% of men do not have cancer. Less than 1% of all men undergoing screening may have unnecessary treatment with associated costs and complications. It is important to know that nothing we can do, including testing, is 100% reliable, and only a small fraction of men have abnormal screening. I would like to address a few things men need to know before and after screening. First and foremost, men need to know if they are at high risk of prostate cancer, including African heritage, family history with your brother or father, increasing age 50 and above. Men need to ask their doctor about screening with PSA blood test and digital rectal exam. You need to start talking to your doctor about PSA screening at the age of 40 if you are at high risk, and at the age of 45 if you do not have high risk. Before testing, no sex or exercise is recommended for 1 week. If you are in poor health or age 75 and older, the value of screening is limited. After testing, talk to your doctor to understand your results. Is your testing normal, or do you need referral to a prostate cancer expert? I'd like to draw a parallel between taking care of our health and driving a car, and leave you with a few questions. Do you want to continue driving dangerously, to stop driving altogether, or to navigate your car wisely? Thank you for your attention.
Thank you, Faye. Thank you. I'm now going to introduce Katie Goldrick, who is the chair of the Holbrook Board of Health. Katie?
Hi, everyone. Thank you very much. My name is Katie Goldrick, and I'm the chairman of the Holbrook Board of Health, which is a local board of health in Norfolk County. And I wanted to begin just by, I am involved with AdMeTech last year. I met Faye through the phone. I haven't really seen her in person one-on-one, so this is really nice. But it was through taking on a local board of health level, deciding to take on prostate care education. And we decided we were going to host a prostate care information health fair in our town. And I have to tell you, as a woman trying to get a bunch of men to come to this fair was virtually impossible. Professor Cox, you were perfect. I mean, your story is wonderful, and I wish we could put this on every screen for everyone to hear it, because even the words that you said today, people just hide, and they don't want to talk about that kind of stuff. So it's important, and it's real, and it definitely impacts everyone. So my goal at the time was to try to get men there, to try and get groups there, to try and maybe get their wives there or their daughters, and sometimes with men it's very difficult to have those conversations. So AdMeTech does a really wonderful job bringing that on, and as a local board of health, it's really nice to have a representative and a state senator, because I have to tell you, if every local board of health took this on, if this was an opportunity, or funding was available, or education was available on a local board of health, we could really get this done. There's 351 there's 351 municipalities. Everyone has a local board of health, and it would be wonderful, if that's something that we could take on in the future. But kind of veering back to COVID-19, obviously this is impacting everyone. We have, if we're just talking figures, I think it's about 139,000 active cases as of 4 o'clock today, I checked. Today we brought on another 565 cases today, 21 deaths. So we're at over 9,700 deaths here in Massachusetts alone. So it's certainly impacting us. Every local board of health is quite literally on the ground, or we are reaching out to our housing units. We are reaching out to our low-income housing units. I'm texting the managers of these facilities. We are providing cleaning kits for low-income families. So what we have seen from the very beginning, I'm going to give my town for example, is we've seen it in phases. So in the very beginning, I would say March, April, we had all healthcare workers. A lot of the people that were coming through were healthcare workers, and then very quickly it was everyone that worked at grocery stores or retail stores. And then it just, over the summer, it was large events. If you went to a large event, you were exposed and you got COVID. And now the most important thing that I've been really trying to push this in my town is it's family spread. It is happening within your own family. We have had deaths from one family member bringing it home and not having a good plan at home. So if everyone was to walk away and just understand that, just like everything else, just like prostate care, just like anything else, preventative care is so important. You have to have an isolation plan. You have to identify. You have to literally say those words. What happens if one of us comes home with COVID? What do we do? That plan needs to be already done. You need to identify a bedroom in your home. It'd be wonderful if that COVID positive person has access to their own bathroom that they don't have to share, but that's not going to happen in every household. So if you're sharing a bathroom, well, that person stays in there for potentially, 2 to 10 days, sometimes longer. You have to have a plan in place. One person has to clean the bathroom after each use. You have to have those cleaning products. Those are extremely important. And I have to tell you, when we have someone who works at a grocery store, let's say they make $14 an hour, and they start getting sick on a Tuesday, they get tested on a Wednesday, Thursday or Friday they find out that they're COVID positive, but they don't get paid till the following Tuesday. And being at a grocery store every day, they might be able to pick up, a $4 food item for lunch, or they might be able to pick up whatever cleaning item came in on delivery that day. So suddenly they have no food, they're COVID positive, and they have no cleaning products. So on a local board of health, those are some of the really immediate problems that we have. We have one of the fortunate parts of being a small town is I feel like I do know everyone, so we are able to manage it much better because just whether it's by word of mouth or social media or reverse 911. Those large cities and especially those low income cities are really hit very, very hard. I know that we have some of the counties that are the worst hit. Middlesex and Suffolk County, they already have like 29, 39, 36,000 cases. Something really, really it's really, really high. So one of the opportunities that Governor Baker and his administration have done wonderfully with is the Stop the Spread program. So that's really what we are focusing on, especially in the cold and flu season. Holbrook has already received its first flu case, so it's here. And the Stop the Spread program is wonderful because it's extended now through January 15th, and it's in many cities throughout Massachusetts. It's open to all Massachusetts residents. It's free. It's not restricted to anyone with symptoms or without symptoms. So if you think you were exposed, or if you know you're exposed to someone with COVID-19, you can get tested. If you are planning on going on a trip or you came back, you can get tested at no cost to you. So there are many sites. You can simply Google Stop the Spread Massachusetts, find a location, get tested. It is one of, I think, part of the washing your hands, part of the social distancing, part of wearing a mask. I think that Stop the Spread program is part of why Massachusetts, I think, has become one of the nation's leader in how we've handled this COVID-19 disaster. And just like with prostate cancer, your advocacy is important. Advocate for your family, advocate for your workplace, come up with a plan. We call it an isolation plan, and reach out to your local board of health, find out what services are available. And it's not something that can wait. It's something that will hit you without you even realizing it very quickly, especially going into the cold and flu season. I think everyone needs to be proactive and not reactive, and take this thing seriously. And that's been very difficult because we have received a lot of mixed messages over the past few months. This is real. This can really impact you, and we need to take it seriously. Thank you.
Katie, thank you so much. I'd like to take this time to thank all of you who presented here tonight. The information that has come, a lot of times we think we know this, but we always hear something new. As I say, you can learn something new every day. And I so appreciate it. Faye, I wanted to give you the opportunity to have any closing comments before we go into a Q&A, a question and answering period.
Thank you so much, Kathy. And I just want to reflect on what just about everyone highlighted on this panel, and that is the critical importance of advocating for yourself. The critical importance of having the basic knowledge that would make it possible for each individual to advocate for himself around prostate cancer, and for all individuals to actually to be able to protect themselves, their families, and their communities. So knowledge is critical. And Kathy, and thank you so much for helping us organize this event that actually made it possible to discuss critical tools that men can have in interactions with their physicians regarding prostate cancer, and everyone can have in terms of protecting themselves, their families, their communities against COVID.
Mm-hmm. Thank you. Thank you all so much. You know, I wanted to ask Reverend Brown. I know this we're in the Q&A period, but I also wanted to ask a question of Reverend Brown, because you host a food bank, and I wanted you to talk a little bit about that and talk about your experiences with COVID during this time that you're feeding families on a regular basis. Please.
Well, thank you so much. This has been so much information. I wish I could have pulled my whole congregation and my associate pastors that I my colleagues into this. This was wonderful. Thank all of you. Kathy, thank you. Kathy and I have been knowing each other for quite a while. And this has been good. Again, I pastor in Cambridge at the Massachusetts Avenue Baptist Church. And I have been at the church for almost 30 years. Not as a pastor. I'm only 21. Not as a pastor. I'm in the pastoral position now for the past few years. We do serve our community. We have one of the largest food pantry and also a hot meal program Monday and Friday. And we see folks, as a matter of fact, today we had our food pantry. Our food pantry do not look the same as it used to. There is no touching, there's no handling, there's no bags, none of that. So what we do, we pack the night before non-perishables and perishables the morning of. As a matter of fact, the data I got today from my staff and volunteers, we fed 210 families, and I'm seeing them from all over.
Yeah.
When we were able to do data, collect data, you know, it was in the Middlesex County where we are. But now I am seeing folks as far as Taunton. I'm seeing folks as far as Gloucester. I'm seeing folks, you know, the Mattapan, Dorchester, in the area. So that's what's going on. My heart is in taking care of the less fortunate. My heart is the pantry and the food program, more than preaching. Anybody could get up there and preach. This is the gospel according to me. On when the COVID started, and in our food program and our meal program, Monday and Friday, we will see on a monthly basis over 400 men and women. within the last 2 years, 2017, the end of 2017, 18, 19, and now, we have seen the numbers have grown. The ages have gotten younger. And let me say this, it's not only the people that are on the street that are suffering from something. We are seeing the working poor. When the COVID started, right before the COVID started, we were doing on a takeout basis. That means we'll pack the lunch and you just come in and you know, if you want your phone charged, stuff like that. A lot of the guys use the bathroom, the facilities and stuff. On the 25th of March, we had to shut down from takeout to not at all. We have just started with the help of the Boston Food Bank, Loving Spoonful, my beautiful city. I'm married to a Cantabrigian, so I'm adopted Cambridge. So with our city government, we have opened the end of September. Now it's on a takeout basis. And in the city of Cambridge, a mask outside, inside is necessary. So I know that some of our clients would be very hard for me to tell them that, you know, you got to wear a mask. So what has been going on in our takeout program right now, and since the weather has been good and you know, God is on our side that way, our meals are pre-planned and packed, and it's delivered to Central Square. Central Square is the main square in the city of Cambridge. And we have been, I call it a blessing, we have been blessed to have an excess. So on our excess, we take it down to Methadone Mile in Boston. So that's what we're seeing. I'm able to, with some of my colleagues in Boston, I've got tons of masks. So when I pack a meal, I pack a mask. I pack a meal, I pack a mask. Today we had the food program, the pantry program. In the pantry program, in our bags, there are masks in the bags. Things are so, I will call it tight. There's no cleaning products. Before we were able to get cleaning products, there's no cleaning products. So ever so often, within the last month or so, we will purchase cleaning. We will purchase tissues and mini hand sanitizers and put it in our dinner bags and in our pantry bags. So that's what's going on. And I pray that, you know, we get over this. Prostate cancer, it is very hard. I am a patient advocate over the Dana-Farber. Mm-hmm. So I know what it's like for advocacy. And someone said it on the panel that women, we would grab somebody and talk. you know, walking into Dana-Farber and somebody in the elevator, you know, hey, all of a sudden we've got friends. And I pray that the brothers would get it that way. I pray that even in our churches, over the years, I've had AIDS awareness. I've had breast cancer awareness. I had folks coming from, you know, for AIDS. But prostate cancer is like the hardest to pull. And Brother Harold, you know, I wish I could just tape what you said and use it over my intercom at Mass Ave, or use it over for our interfaith pastor meetings and stuff like that, because it's very, very hard. But this is greatly appreciated, greatly appreciated. If you know, and I know paper and all that, but we know that we're not going to be in this forever. I would love to have some handout or something to post along, or to put in the bags, to put in the bags of our weekly dinners that we sent out, to put in the bags in our pantry. We've done it for AIDS. We've done it for breast cancer. We've done other walks. I think, as a matter of fact, I'm on one of the boards of directors for the Scleroderma Foundation. And, you know, we do walks and put that. So I don't know if it's possible.
It's a great idea.
For some kind of handout. I will meet you and get it, so that we could put the word out and put out some literature. I will distribute. All I need to do is to have it.
Okay.
Reverend
Thank
Brown,
you.
it will be our pleasure to provide such information for you. We have a one page that summarizes everything that men need to know to talk to their doctors, and we'll be happy to. It will be our honor to provide this information to you. We do have a question from the audience, Katyan, and the question from the audience is: what is recommended in the cleaning kit? Dr. Cox, would you like to address what is recommended in the cleaning kit for COVID?
First, let me just say to Reverend Brown, invite me to your church. I'll come.
There you go. Connections.
You've got an open invitation, sir. Open invitation. And I'm going to follow up with something.
Glad to come.
Thank you.
So for a cleaning kit, I suspect that you want to have any number of products that will be able to clean the floors in your house, to be able to clean the sinks in your house, to be able to clean your hands in your house. And those and in any surfaces, because the virus can live on the surface for some period of time. So having things like Clorox or some other kinds of products, those Clorox wipes, it's critically important to have in the house. So those would be the things that I would focus on: the surfaces that are there, and things that can clean your various surfaces where the virus can live. Things that can clean the floor area, as well as things that are important for cleaning your hands. It's most important to be able to take care of cleaning your hands.
Thank you so much.
We had another question from our Norwood group, and I think Faye, you answered it, but it bears reiterating again. It had to do with the age of. Let me read it. So, what age should you get checked for prostate cancer? And secondly, if there's any hereditary in the family gene. So you've already talked about that, but I think it doesn't hurt to reiterate it again, please.
I will start with the second question, which is hereditary nature of prostate cancer. And it definitely is a hereditary disease. And men are particularly at risk if their father or their brother had prostate cancer. Now, we do not know, we do not have sufficient data to actually determine. For example, you need to be particularly aware if your brother and father had aggressive disease and actually ended up losing his life to this disease. So you need to be particularly careful. But the emerging data also indicate that it doesn't really matter that much if it was aggressive prostate cancer that your father or brother had, or it is maybe even innocuous, subclinical, what we call slow growing, not very dangerous prostate cancer. Because the way genes work, men who inherit this gene can develop aggressive prostate cancer, even if their father or brother had disease that was not dangerous. Okay. And the first question was at what age to actually start getting screened, correct?
Yes.
Okay.
Yes.
If you have a high risk for prostate cancer, African heritage, family history, father or brother, if you're 50 or above, you actually need to start talking to your doctor at the age of 40, even if your doctor does not initiate conversation about prostate cancer. That's where your advocacy for yourself is going to be absolutely critical. If you do not have high risks, you need to initiate conversation with your doctor at the age of 45. The best evidence we have today indicates that actually testing with PSA screening, even for men who do not have high risk, testing of men at the age of 45 can predict very accurately if this man is at high risk of prostate cancer or if this man is not. For example, if PSA level is less than 1, probability of dangerous prostate cancer within 10 years is less than 1%.
Okay.
If PSA level at the age of 45, or if you're in your 50s, if PSA level is between 1 and 3, you need to be very careful, and you need to get tested at least every 1 to 2 years. If your PSA reaches 3, you need to talk to your doctor about referral to prostate cancer expert to be evaluated potentially for more accurate diagnostic tools and to determine if you need biopsy. What else I want to mention is experience that Dr. Cox shared about the way he was treated with prostate cancer. Right now, we have such powerful diagnostics and what we call precision diagnostic and therapeutics that they actually can help us determine fairly accurately who needs treatment, who does not need treatment, who needs biopsy, who does not need biopsy, and how to treat men in such a way that we will control cancer in the best possible way, but will cause the least complications.
Thank you, Faye. And Faye, I want to have a question that you and I had talked about, because prior to your working with prostate cancer awareness, you worked with breast cancer awareness. And as I stated in my statement, that you were the first person to talk to me about the genetic link, a possible genetic link between my dad and myself, where he had prostate cancer. I was a survivor, and I was a breast cancer survivor. Can you talk a little bit about that? Because I think if breast cancer is in your family, what are some of the things that men need to think about?
Absolutely. It has been shown that daughters of fathers who have prostate cancer are at high risk of breast cancer. Men who have mothers with breast cancer are at high risk for prostate cancer. It runs in the family. It's a family disease. So in addition to what we already discussed, African heritage, family history, with brother or father, you also need to be aware. Beyond that, you need to be aware, did your mother have breast cancer?
No, my mother had renal cancer, which there were other cancers in the family, but it's the prostate cancer that is the link.
Are there any other cancers in the family? Was then you need to discuss with your GP if it would make sense for you to have genetic counseling based on your family history. Does it make sense to have genetic counseling in addition to being directly aware about direct risk of prostate cancer? You need to discuss with your GP about the possibility of genetic counseling and being tested perhaps more broadly than just for prostate cancer.
I see. Thank you. Harold, you had a question?
I do. Dr. Stern, I'm really glad to hear about the precision testing that's happening. Clearly, that was not available at the time that I experienced this a number of years ago. And there's been lots of advances. I think the important thing is for people to be able to go to their docs. And that's the most important lesson about all of this. Go to your doctor on a regular basis and get the kind of testing that is suggested at that time. And the docs will be very aware and cognizant of what a patient needs at that time. So, but I'm so glad to hear that the technology is beginning to change. And finally, I would say to State Representative and to Senator Rush that as you are doing activities in the State House and you need someone to come and tell their story, I'm willing to do it. So I put that offer out to you, and Kathy can certainly help you to get in contact with me. I have to sign off right now. I'm really glad that this happened, and continue the really good work. And Katie, thanks for being so thoughtful about what needs to happen in your particular community. Goodbye, everybody.
Thank you.
Thank you so much, Harold. Thank you. Be well. Stay well.
Katya, we also have one more question that is not directly relevant to this discussion, but nevertheless, somebody is asking a question Is it known how many people in the United States are resistant to antibiotics due to overuse? Does anyone want to address this question, Katie? The question is, how many people in the United States are resistant to antibiotics due to overuse?
I don't know that. That's a great question because I'm sure it's a very high rate, but I don't know. I would have to research that. Certainly something I would bring back though.
This is definitely not my area of expertise either, but I can tell you right now that resistance to antibiotics is a fairly extensive problem, particularly in hospital settings. So the more you spend time at the hospital as an inpatient, the greater the likelihood of your contracting infection that would be antibiotic resistant.
Mm.
Well, and this is on a very small, impact, but even the we call them COVID kits, our cleaning kits that we give out, and we are working with our food pantry as well. We're not giving out even the hand soaps that we're giving out. It's general hand soap, super simple. We don't want any antibacterial hand soap. That's so prevalent throughout everything else that we do.
Yeah.
Just general hand soap when you wash your hands. That washing your hands, wearing your mask, plain hand soap.
Yeah, and I agree with Katie, and I want to emphasize that coronavirus is virus. So actually antibacterial drugs do not work for viruses. Viruses require their own antiviral drugs. Antibiotics, traditional antibiotics do not work for viruses. That's why there is such an extensive research and development to actually create not only antiviral drugs, but antiviral drugs specific for COVID. On a positive side, we do have promising antiviral drugs. Mm-hmm. One of them is, I mentioned, is remdesivir.
Right.
A second drug that is very promising is man-made antibodies, meaning against the virus. What I mean by that is that patients who are COVID survivors generously donate their blood, and their blood is processed to find the most potent virus neutralizing antibody, and then creating a process of cloning this most potent virus neutralizing antibody. And actually, that's how President Trump, that's exactly the medication that President Trump received, antiviral drug remdesivir, and very early after diagnosis, he also received potent antibodies against coronavirus that are very promising, have been very promising in initial clinical trials.
Thank you. Senator Rush, can you talk a little bit more about the programs that you have at the VA? I obviously have retired officers in my family and whatnot, and they have had wonderful services at the VA in Brockton, my father-in-law especially. But what kind of things are happening regarding prostate cancer specifically? Is it in more than one area, or is it more area? Is the Boston area have more of the programs?
Well, I can speak to my own personal experience. I have, despite maybe media reports, I have had phenomenal health care through the VA system that I've been using since I returned from Iraq in 2012. And they have really done an unbelievable job in a holistic approach to each individual patient there, from head to toe, inside and out, making sure that folks have knowledge and education and awareness of anything that possibly could affect them in an adverse way. So there's been this great level of education, which I have found to be terrific. My primary care doctor, he is so thorough and so wonderful, and their communication out to patients in terms of making sure that we have this knowledge so that we can get ahead of possible issues we may have medically moving forward. So, personally, I've had this phenomenal experience, and I encourage veterans that I know to if they're not using the VA system, to use that system. And as you know, here in Massachusetts, we have VA Boston, you have the Brockton campus, you have a Jamaica Plain campus, a Boston campus, there's a Bedford campus. And so good are so many of these doctors in the programs. They have vans coming in every day from all over New England, all of the New England states, to see some of these fantastic specialists we have. So as said earlier in some of the comments, it really comes down to this idea of having good knowledge and education to be ahead of the game. And as mentioned, Rep. Livingstone and I have been privileged to work together on your behalf at the State House, and he has been such a wonderful advocate, and I am just thrilled to partner with him to talk about these issues and get people aware of them. So thank you.
Thank you. And I have a question for Rep. Livingstone in just a minute, but Faye, I just got a question on the Facebook Live, and they just asked for confirmation. So it's antiviral instead of antibiotic for bacteria.
Absolutely.
Okay.
So for bacteria, we have antibiotics that bacteria. For viruses, we have antiviral drugs, such as, for example, remdesivir, that was tested by NIH and was shown to be effective, particularly in severe disease. It is expected to be even more effective much earlier, in earlier stages of the disease. So this is a different antibiotics for bacteria, right, and antiviral and antibodies for viruses.
Okay, thank you. Thanks for learning.
Your permission to comment in response to can I please have your permission to comment in response to what Senator Rush presented at the beginning and what he just mentioned? I think what is important to point out and highlight what he said, with equal access to care, VA system has eliminated disparities in outcomes between white and Black individuals. It's a very important data that came out actually early this year based on a very large-scale study completed by VA system. So there is no disparities in prostate cancer mortality or any other outcomes in a VA system because of equal access to care. Massachusetts has universal care. With appropriate education and awareness, we will eliminate prostate cancer disparities in Massachusetts, just like we have eliminated breast cancer disparities. Because today in Massachusetts, with equal universal access, there is no difference in mortality between in breast cancer between Black and white women. With education and awareness, I strongly believe we will be able to do the same thing in Massachusetts, and we will create Massachusetts model of national leadership in doing that. And that's why I'm so grateful to Representative Livingston and to Senator Rush for championing our programs at the State House.
Absolutely. And you know, it's interesting because that question that just came through was from Pennsylvania. So for Rep. Livingstone and Senator Rush, it's you know, a wake-up call to others in other states to start knocking on the doors of their representatives to get the same assistance and you know, resources available to them in their own state. So it's been great having the both of you on this program. So appreciate you taking the time. You know, Reverend Livingstone, I wanted to talk to you a little bit about the resources that are available, the state resources that are available as it relates to disparities for prostate cancer and for COVID. Are there anything in particular you want to point people to, or do they go to your website? Or how can they get more information?
Yeah, I've tried to make information available from the state, available on my website, which is jlivingstone.com.
Okay.
The state does a great job on its own. And if you search for State of Massachusetts COVID, you'll see the mass.gov link. We'll have information about testing, about, you know, some of the protective things that were mentioned by a couple of the speakers tonight to do, like wearing a mask, cleaning products to use and such. And then the governor holds a press almost every day. It slowed down a little bit in the last month. And then there's also, you can sign up for text alerts from the state of Massachusetts as well as from the city of Boston. And those are pretty regular. I don't have that off the top of my head, but that is on my website.
Okay.
And it's and then for the city of Cambridge, they don't have the text alerts, but they have a daily email that comes out from the city manager, and you can sign up for that through the city website.
Oh, great. Okay.
There are a lot of resources, and then what's also happening in Massachusetts is the governor, maybe 6 weeks ago or 2 months ago, started a classification system for towns, where if a town in Boston just went into the red, I think there are 64 cities and towns out of the 351. And then when that happens, there's a greater focus on that town where more resources are brought to bear, do more testing, to do more education, to really try to bring down the rate. You know, right now in Boston, the rate of infection is increasing again to a significant degree in a way that we haven't seen for several months, and it's really important to redouble efforts of, you know, just wearing a mask. You know, something as simple as that makes a huge difference. I wash my hands probably, you know, 10 times as much as I did last February, and that makes a huge difference in just, you know, being as safe as you can.
Thank you so much. Thank you. Faye, I don't have any more questions on our end. Is there anybody else that has a question or more comments that you'd like to make?
I will be happy to make a comment if I could.
Yes, please.
There is a very clear-cut commonality between prostate cancer and COVID-19. Please advocate for yourself. If you have symptoms, for prostate cancer screening, please take charge of your health and talk to your doctor. Mm-hmm. For COVID, to start developing any kind of flu-like symptoms, please make sure to be in touch with your doctor, because early detection, either COVID or prostate cancer, saves lives, and it enables life-saving interventions.
Mm. And Faye, could you also talk about the gene testing for men, because it's mentioned often you hear about it all the time as it relates to women, but men, in what case would you advise that a male, have the gene testing if he does have a mother who has had breast cancer?
Actually, I would approach this question slightly differently.
Okay, thank you.
If I may, Katian. Mm-hmm. Because right now what we have emerging is very powerful, what we call cancer genetic profiling. So in other words, if man is diagnosed with prostate cancer, and prostate cancer particularly appears localized, mm-hmm. it's very difficult to predict if this prostate cancer is going to be very aggressive in a significant fraction of men, or whether or not it will be just something that is not going to cause problem. Mm-hmm. So right now, just like we are doing biopsy for histologic sampling, right, to look at pathology of prostate cancer, we have the ability to send tissue sampling for genetic tissue analysis that is extremely accurate in predicting. This genetic cancer profiling is very accurate in predicting what is not dangerous and what should be left alone. No treatment is necessary. What is extremely dangerous, what needs to be treated right away and aggressively, and what is, and this is the largest, probably a fraction of men, what is in between, so to speak. It's not too aggressive. It's not too slow growing, but there is a large fraction in between. And for this man, we have image-guided, minimally invasive treatment that we can offer today that has a similar cancer control, but fewer complications. Katya, any other questions for me?
I don't have any other questions. Nothing else has come in. I don't know, Katie, if anybody else has any more comments or questions that you want to ask. The floor is open.
Nothing from me, but I just want to say this was a wonderful moment and opportunity, and I hope that anyone that gets a chance to watch, it takes away a lot more knowledge than when they came in. Thank you, Faye. Really great opportunity again.
Thank you so much. Thank you for your participation in this. And I would say, I dare say that this will not be the last time that we're doing this again. I have a couple more being planned in the future with Faye's permission to do this again, because what I love about this, and I think on the as they're coming in through Zoom or actually through Facebook Live, is that we're actually able to get people across the country, and I think that's pivotal, and that's going to be really important, as well as here in Massachusetts. I know some of you that are on here, so I'm like, okay, we need to get these people together and get the connection together so we can get the awareness out there.
I would just like to say thank you, and to get in touch with me, could get in touch with me through Kathy, and I will be more than happy to receive any brochure that you might have.
Oh, absolutely.
Thank you so much, and I have to sign off.
Thank you so much.
Have a great night, and thanks for having me.
Okay, thank you.
Thank you.
Thank you all. And Faye, I'll talk with Thomas about getting those the handout to Reverend Brown. Okay, I'll get you all the information.
I will make sure to provide it. I want to thank Thomas, who is not.
Thank you, Thomas.
Thomas Satam, who is behind the scenes managing.
No problem.
He
There he is.
And he's managing this technically, and our outstanding intern, Marianina Stewart. Guys, thank you so much.
Very much.
Thank you all. Be safe.